So guys, today we're going to be tackling a condition we see all the time in athletes, particularly runners. We used to call this Shin Splints, we now call it Medial Tibial Stress Syndrome. If you're ready, let's dive in. Hey guys, Khalid here, welcome back to Clinical Physio. So first of all in this video, let's explore what is Medial Tibial Stress Syndrome. So the cause of MTSS is thought to stem from an accumulation of small unrepaired microtraumas in the outer layer, the periosteum, of the distal tibia bone, or the shin bone. This is often accompanied by inflammation of the surrounding tissue, a process called periostitis, near where the tendons of muscles attach to the bone, and that the mechanical action of these muscles pulling against the periosteum is a clear factor. It's believed that the repeated pulling of these muscles could lead to the periostitis and the tiny bone injuries. However, it's still not quite clear whether periostitis or the bone damage happens first. So that's how it happens. Now let's split up our treatment of MTSS into three different sections, starting with patient education. So within patient education, the fundamental approach involves a careful and gradual increase in loading and impact of the tibia. The focus of exercises is not solely about strengthening, but rather on progressively increasing the exposure to loading and enhancing impact tolerance of the tibia. It's crucial, therefore, to conduct capacity testing and then incrementally introduce the patient to higher loads as they demonstrate the ability to tolerate them. The goal is to keep activities as pain-free as possible, aiming to limit any pain exacerbation to a 2 out of 10 on the VAS scale between 0 and 10. Sleep and nutrition play significant roles in this process to help bone healing, and it's important to remember that symptoms may last 9 to 12 months for an athlete having shin pains for 3 months. So the second part of treatment, as we mentioned in education, is a graded loading program designed to gradually increase the load and impact that goes through the tibia bone to make sure that it can gradually increase its tolerance to load. Now, as we said, it's really important that this is done in as pain-free a manner as possible. Rather than going from 0 to 100, we need to really slowly, incrementally increase the amount of load going through that tibia, as we'll explain in a second. So whilst that graded loading is perfect for our bone remodeling, what about the muscles? Well, research has suggested that when individuals have lower muscle strength, they are less able to withstand the movement and small micro forces which are put through the tibia, which could contribute to MTSS. So therefore, as well as the loading program we're going to give you, general lower limb muscle strengthening is always going to be helpful too. So on the screen now you can see a series of exercises that we could use in different levels with our patients with MTSS. Now the idea here is that each of these exercises can also be used as a capacity test. Let me explain. So if we were to start our patient at level 1 with something like marching on the spot or walking across the room, we would want to make sure that they can complete this activity for up to 90 seconds pain-free, and then we can progress them on to different exercises within level 1. So you can see how this becomes a capacity test as well as an exercise, because we're looking at the patient's ability to tolerate the exercise before we move on to future levels. So once the patient can complete all the activities within level 1 at 90 seconds pain-free, we would then move on to different exercises as you can see in level 2. Naturally, we would take our time going through those, making sure our patient can cope with those before moving on to level 3. So how long do you spend on each level? Well, it totally depends on your patient's ability to respond to the different exercises and whether they can tolerate them or not. As a result, it's really important to plan your treatment in line with what the patient can cope with, making sure that you only move from level 1 to level 2 when they can cope with that, and that you move from level 2 to level 3 when they can cope with that as well. We have an interesting point from Warden et al. Where they suggest that loads must exceed those experienced during routine activity that caused the initial irritation of the tibia. Therefore, this suggests to us that using pain-free plyometrics, as you can see in level 3, may well have a place in latter stage rehab, making sure the patient can cope with those and therefore will definitely be able to cope with the loads during their normal activity. And the third and final treatment option is adjuncts. Now we really have to mention that both of these adjuncts we're about to talk to you about are not totally supported by the evidence quite yet. There's not quite enough evidence for us to fully put our confidence in them. The first option is shockwave therapy. Now, shockwave is gaining real popularity for lots of different conditions, and one suggested option is that it can help with that bone remodeling with MTSS. However, we do know that shockwave therapy can be really painful for individuals with bone conditions, and therefore we really have to say that it needs more evidence for us to be able to use it in practice. The other option is the use of foot orthoses, particularly those which support the medial arch of the foot, especially if they are used bilaterally. Whilst it doesn't work for every patient, it is an option to help your patients if they find it's more comfortable for them when they use arch supports. So guys, I really hope you've enjoyed this video. If you have, please support us by smashing that like button. And remember, you can join us for many more different videos by subscribing to the YouTube channel. We also have our Instagram account @ClinicalPhysio and loads of amazing resources on our membership website, member.clinicalphysio.com, to help those who want to improve their practice. My name's Khalid. Thank you so much for watching. See you soon here on Clinical Physio.